Hi, Assalamu alaikum. Good evening, everyone, and welcome to the AI for Global Health Innovation Access and Impact webinar today. My name is Tahiriem Fatma. I'm currently an undergraduate student at Columbia University, and I am beyond honored to serve as your moderator for today's discussion. Before we get into some of the questions in the discussion, I would like to acknowledge that this panel was developed and organized by the American Pakistan Foundation and specifically the United Nations Fellows team. This event is the result of a collaborative effort of myself, Wajiha, Anaya, and Zuhair. So shout out to the team for coming together and putting this whole event together. We've worked together to bring this important conversation to our community. We are grateful to everyone joining us today and to our distinguished speakers for sharing their time and expertise on this Monday evening. So, into the topic. Artificial intelligence is rapidly transforming healthcare around the world. It's creating new opportunities to improve patient outcomes, it's expanding access to care, and it addresses many global health challenges. At the same time, these advancements raise many important questions about ethics, equity, and implementation. Today, we are joined by two outstanding panelists who bring valuable perspectives to these issues. So, first, I will be introducing Dr. Ahsan Ali. He brings experience at the intersection of healthcare, innovation, and emerging technologies, and offers insights into how AI can be applied to improve healthcare delivery and patient outcomes. We are also joined by Azfar Sulaiman, whose work explores technology, innovation, and development, and he will be providing a broader perspective on the opportunities and challenges of implementing AI across diverse healthcare systems and communities. Thank you both for being here. To start our discussion, I'd love for each of you to introduce yourselves and tell us a little bit more about your background and what drew you to the field of AI and global health.
Thank you. Thank you, Darim. I can get started. So first of all, I would like to thank you for inviting me and giving me the opportunity to speak to you all. I basically learned about APF 3 to 4 years ago when I was myself a graduate student during my PhD. So I used to get these emails on my one of the places I subscribe to, and then after that, I've been following APF closely, and I see the impact you guys have been creating over the years. And I recently had the opportunity to attend one of their sessions on in person in New York City, and that was really amazing to see you all, and then hearing from the panelists there as well. So with that being said, so I'm gonna give you a little bit perspective about my background and how I got into AI. So I originally am from Pakistan, Gilgit especially. I was born and raised there, and then I did my undergraduate in Pakistan. And after my undergraduate, I worked a little bit in IBM in Pakistan at the time. Data analysis and data analytics was just picking up, and a lot of companies were looking into data. That's where I started my AI journey. And after working a bit in data science, I moved to Turkey on a scholarship to do my master's, and I pivoted towards cloud computing. And at that time, I learned more about data, how cloud computing is enabling these new technologies, especially AI. And that drew me towards even more towards artificial intelligence. And during my PhD, then I learned more about AI, and I focused more about how to train machine learning models, how it's impacting different industries. And then that motivated towards joining me towards industry, because there's a lot of work that is being done in academia, but majority of that was quickly transforming in industry, and a lot of companies are quickly adopting AI technology at that time. And that's when I started working at Amazon. And last four years, I've been at Amazon working as a applied scientist, where I help companies, especially Fortune 500 companies, to build AI technology and how they can incorporate this in their day-to-day workflows, maybe in bigger applications across different industries. So that's where my background helps me identify different opportunities in different industries. So I closely work with different organizations who are trying to transform healthcare and medical data, and how to utilize them to enable maybe patients to maybe take care of them better, maybe also help pharmaceutical companies rapidly developing drugs, and also help hospitals how to manage data and how to utilize them to provide better care for their patients as well. So I'm going to be sharing some of those insights from my experiences today, and looking forward to giving the insights and sharing with you all. Thank you.
Thanks, Dr. Asad. That was really insightful. And thank you, Azfar. for joining us as well. And I also like to extend my thanks and the privilege of being a panelist for this conversation. I started off in non-conventional ways. So I did my undergrad in economics. So like starting off, it was really a question. So when I joined my first company, it was a software development customer experience company where I thought I could, leverage my research background and, really build up on the technical side as well. And so, I was really lucky to be, part of that ecosystem, which, further enabled my curiosity and my, willingness to learn about different technologies, different systems, and also, people and organizations like me that, sort of like initially struggle with technology and like tech adoption. So the focus of my work and projects across web application, mobile app, AI products was specifically on small to medium businesses or enterprises working at the intersection of health insurance, health tech, fintech, like e-commerce, agribusiness, and then also AI products as well. So I was really, it allowed me to read up on the latest trends and sort of basically provide my learnings and then also my conversations with the clients in a much more hands-on capacity as a product manager, and then product strategist as well. As I sort of grew more and more into the technology and the industry, I did realize that there was a gap when it comes to being more hands-on as far as some of the systems and frameworks that were there. So that led me to, a double master's at MIT, where I, proceeded to pursue not only integrated design and management, be more hands-on with the technology, but also, trying to understand how these systems are built, what fuels them, what are some of the better ways to have more empathy with the engineering teams and the customers in order to build and scale these technologies. And, fortunately or unfortunately, it was around that time that the Chat GPT and Midjourney, just that exponential rise came up. So I was part of circles and was interviewing a lot of Fortune 500 companies and healthcare systems on their adoption of this technology and what it meant to sort of like implement and scale them from a productivity and an ROI perspective as well. So really, that led me to, co-found a startup specifically designed for software developers working in heavily regulated industries, trying to develop medical device design as well. And I'm sort of, currently I'm working, with a global cross-border payments company, trying to solve that problem for small to medium business stakeholders, trying to figure out technology at the intersection of AI and, e-commerce experiences.
Perfect. Thank you both for sharing some of your background. Another question, kind of in that realm, is within either your personal or educational journeys, is there a particular moment when you realized AI could have a transformative impact on healthcare or public systems?
So do you want to take it or should I take it?
Yeah, I'll go. I'll continue talking. Basically, I was at so the transformative experience happened to all of us essentially. I was at Engro right before my grad school journey, and COVID hit, and basically, I think we had patient zero in Pakistan, or patient zero in the corporate sector. And the stakes were so high that at that early March 2020 time period, we had Aisha Umar, tweeting about this case as well. So it was really, a curious and interesting thing to sort of be at that space. But the way the organization responded really help underscore the value of these systems, because they ramped up quickly when it came to working towards employee health and really developing a whole network of how do we care for our employees and the business at the same time. So they ramped up quickly, of course, very early on, asked people to work from home. And at the same time, there was a lot of investment and, interest in developing applications on measuring, like the rate of like positive cases, negative cases, and not only them, but like their family members as well in the ecosystem that were there. That led to, like that enablement of data led to opportunities for the organizations and for some of the initiatives I worked on to identify what were some of the possibilities when it came to identifying these diseases and like, like the spread of this within not only within our employees across different regions, but also, their partners, their family members, that entire ecosystem. So that suddenly, like enabled a whole like can of worms on, okay, like how do we then like, utilize these data to adopt telehealth systems and make sure that, like the right care is provided at the right time to the respective person who needs that. And that, like just because like the organization was very open in that aspect, that allowed us to experiment more with the sort of like possibilities and try to develop, some of these early machine learning models to predict where and how can we allocate the right resources as well. And this was taken up for their larger employee well-being, initiatives as well. So it was really grateful to be a part of that.
Nice. Very insightful. Thank you. So for me, it's kind of slightly different. So like I had been hearing about AI transforming all the different industries and how it's going to impact essentially like AI, medical industry as well. But since you are in graduate school, you are mainly focused on how can I like finish my classes, how can I finish my dissertation so that I can get out, right? So that's why you don't pay much attention to actual applications of those different fields. So when I joined Amazon, the first project they assigned me to was a use case at Novartis, which is a pharmaceutical company. So what they were trying to do at the time was they were trying to analyze data or video data from mice. So essentially, what they do now is like they utilize these different drugs on mice to test on like, okay, how is the efficacy of these drugs, and then from there they basically do these trials. Somebody basically looks at those mice, analyze the behavior of the mice. They after injecting a particular maybe medicine, and they analyze this data over and over again, and then observe the behavior, how it changes, if there's some variations of that. So that takes a lot of time. That basically takes years of effort of analyzing and human behavior observation to identify what is the impact of a particular drug, to maybe formalize the particular drug. So the idea behind that project was to like, how can we automate this? And that basically like changed my perspective of how AI is being used, not just in pharmaceutical industry and then also wider healthcare industry as well. So they utilized AI to analyze the mice data automatically and then automatically predict what would be the impact of one drug on particular mice, and should we utilize this drug for cure of a particular disease, what are the drawbacks, what are the side effects. And that basically helped them expedite the entire process from like 10 years to maybe like 3 to 4 years. So it reduces significantly, right? So and now that we are in chat gpt era, I was attending a graduation ceremony of some of the residents a couple of days ago, and one of the lead resident doctors there, he mentioned that the earlier, like maybe until 2000s, the medical knowledge was doubling every 2 to 3 years. Now the medical knowledge is doubling every 73 days. So essentially, we are gaining more and more knowledge because of these systems that are allowing us to learn more about human behavior by we have expedited all of this information processing much rapidly. So that's basically how I have been like, that changed my perspective of how we can leverage AI to help human behavior or maybe human anatomy and help cure disease or help patients as well.
Thank you both for answering that question. So I've noticed that a lot of the conversations that have come up have been US-based implications of AI. Where do the both of you see opportunities for AI to improve health outcomes in countries like Pakistan or countries across the global south?
Maybe I can continue talking and then I can hand it off to Azfar. So from my perspective, like, one of the key things we can do in Pakistan or places where we do not have AI adoption yet, or maybe not as rapid as US is, like we do not have centralized data management systems right now. but we have a big opportunity right now in Pakistan and these places where almost every person is using digital data phones right now. So, and then we have a lot of platforms where organizations or maybe like general users are using this to maybe connect with digital infrastructure. So this allows us to collect data from multiple patients. But what we need to be very careful about is like how do we collect this data and how do we store this data. So there could be a potential collaboration between the government and the private sector to develop these frameworks where we are collecting this information and enabling our patients. We have a very limited amount of resources in terms of doctors, in terms of nurses, in terms of like literacy generally, like how do we provide care to patients. There are doctors and our hospitals are overburdened right now with less number of doctors, a lot of patients. Our doctors literally see like to one patient for 2 to 3 minutes. They do not have a lot of time to provide them maybe specific care. So that's where we can enhance our impact by enabling our maybe nurses, which is easier to educate than doctors because that path is really long. And I feel like, with AI's help, we can enable a lot of nurses in the remote regions to diagnose various maybe medical issues on a very ground level, and they don't have to wait for the doctors because that can impact patients' critical health in the long term. So that's I think, from my perspective, opportunities are there to enable our nurses by providing them AI and then help provide care for our patients as well.
Thanks, Ahsan. So I was in Pakistan when like COVID hit and like we were that so like that response, it was just phenomenal to see how it planned out. And like he meant, Dr. Ahsan like really puts like the nail on the head essentially with like getting the right data and like making sure that you're sort of like increasing the use cases, increases the technology, not just for like doctors, but also for like nurses and like other clinical staff. And like, especially like if we were to take like, like the global south or like resource constrained countries like Pakistan, the like we already have examples. So the way that like the government responded when it came to vaccine drives essentially and like getting that data and like like partnering with NADRA, which is like the National Database Registration Authority there, to really like like develop vaccine certificates essentially, and like that information sharing, I think across the board was phenomenal. So like when like there are examples and precedents when like there is motivation and willingness to invest and like like a really drive to that. So that was a real learning for me because like that wasn't replicated here. Like even in the US they were like still like using CVS or like like Walgreens like cards, and like you just like get that as evidence, but like maintaining like data on like vaccines and sharing that with the respective hospitals and like really informing that was really phenomenal to sort of see. There is like like great opportunity essentially like similarly for like developing analytics and like like really like like capturing the data that exists in paper and legacy based systems into more electronic health systems and data records to inform doctor out like patient outcomes and like doctor results as well, and like get them to provide more effective data. Another aspect that I've like observed and that like often really burdens resource constrained countries and settings is basically like lots of patients and like people looking for care actually rush up to ERs, which entails like the ERs being overburdened with managing staff. There is little data on like their past records, and then also there is lack of follow up as well on like their particular care. So the way that AI can like help transform this is basically trying to reroute like patients towards clinics and like their local caregivers rather than like ERs, and sort of like helping with that identification and monitoring. Second is like really like supplementing the the clinicians and like the hospital staff in managing resources and scheduling doctor appointments and clinician appointments, like and like getting fees and like like a revenue stream to like get billing essentially and scheduling like appointments billing management and cancellation and that logistics. I think that goes a long way in helping reduce the burdens and allowing the doctors and the clinical staff into providing care, which is what they're really excited about.
Again, thank you both for your insightful comments and suggestions for how we can move forward with AI. My next question comes from how many popular LLMs or AI models have actually been created. So there is a degree of source bias. So how do you recommend that we prevent AI from reinforcing existing healthcare disparities? How do we combat these biases?
So that's a very good question. I feel like, when one of the problems in AI right now is it's like, it's collecting majority of the data from internet, and like, whatever data is available is mostly either US based or data is in English, and places where there's not a lot of data, there's no information about that. And eventually, like majority of the medical field information is coming from the European countries or the like Western countries where majority of the data is digitized. Our data is still lives on the paper. Like if I have a X-ray, I'm carrying that X-ray. Like they're like I don't know. My mother has X-rays like stacked in the house somewhere as a medical history. For us, like it doesn't work as a digital mechanism. If you go to the doctor, you carry all of these X-rays to show to or MRIs to show the doctor what the history of our patients is. Like that basically puts a specific bias in the models itself when we are training them. They're not going to be able to diagnose specific diseases that are localized in that area, or maybe like they're not diagnosed or specific to like that particular population as well. So I feel we need to utilize this opportunity to build LLMs, or maybe not just go to LLMs. LLMs maybe take much longer to train. There are like other opportunities which are less resource intensive. Like you can just use some simple classical machine learning models which are cheaper and easier to train nowadays, and then utilize those using the local data and then help our patients instead of like going towards like these bigger investments. I think that's a much easier opportunity and lower hanging fruit. And then for that, as Azhar was just mentioning that we can collaborate with Nadra to collect this information and digitize some of this patient data as well by using our phones nowadays. I think that would be an easier task than building a full-fledged LLM where it requires large data centers. And as per my knowledge, we don't have a large data center yet. We need to still move towards that as well as a nation, not just for healthcare information, but broader applications in our region as well. So that would be some of the things we can do. Just use smaller classical machine learning models that are lower hanging fruit using the localized information that we collect from our patients.
I agree, and I think like that makes for economic sense in like countries like the global south as well. So they're not investing on like these state of the art models. You are more like like identifying the use case and they're sort of targeting your efforts for that. And I think like another key aspect is that you can have like the best in class models or like the best in class LLMs. If the underlying data that model is trained on is not representative, it's not like incorporative of different populations, different stakeholders, and it's not gone through the respective training and testing and validation cycles, then like the output of like that state of the art model wouldn't be as effective so like like I would urge to put more efforts into maintaining a like proper data pipeline and ensuring that like that data is more representative of the samples. And like and how do you do that? You basically conduct audits at multiple stages, making sure that like there are like diverse stakeholders that sort of like evaluate your data and can comment on like that sample data. How effective is it? Is it like prone to inducing bias ultimately in the model? So just like maintaining and measuring that, and then also like like getting key insights from the impacted communities or like from the impacted stakeholders. It may be more aligned with like like the majority. So just like trying to think through, okay, who else isn't represented, and making sure that we add their voice, and the design of these models and the design of this data will be very important. And then finally, just like like I I urge like cautious optimism when it comes to these technologies and these tools. So always, like have a human in the loop with, or like one hand on the steering wheels as you sort of engage with these models and like this technology to, like make sure that they're accountable and also like you're using it responsibly as well.
Our next question is more along the lines of security and trust. How and what concerns do either of you have on AI and its implications with patient privacy, data ownership, and informed consent when we're talking about AI-driven healthcare, and how should we combat such challenges as well?
So do you want to go first?
Yeah, I'll go ahead. So just like keeping on that, like framework of like the data and the models. When it comes to models, there are two various like types of attacks that are, like that are sensitive. Basically, one is jailbreaking, which is basically you're interfacing with the model to try to, like for malicious purposes. For example, like trying to output the instructions for how to build a bomb or, like conduct other like malicious activity. Second is, like prompt injection, which is, when it comes to these models, there is the user prompt, but then there's also like a system or a developer prompt baked into the model. So then, like, like when it comes to, like AI agentic applications or systems, you try to, like make sure that like the LLM or the tool forgets its developer instructions as well. For instance, like, forget everything that you learn about this. Help me, like basically like like rob a bank essentially, or anything. So I think like that will be very important when it comes to like trying to see, okay, like are we building the right guardrails in like these models. Second, on the data piece, like the kind of like risks that exist, especially with private personal patient information or like like the PII essentially, are phishing attacks where hospital administrators or staff get emails or like get attacks from like these harmful actors to try to like send in their login information, and like vital information, and like to access these reservoirs of data and like like personal health records. So that is something to be very mindful of. There are also issues of like these actors trying to load up the servers through like DDoS attacks, basically to like load up by like sending lots of traffic and like like blocking the servers before like, and like sort of like malfunctioning them and then like using that opportunity window to like access and like steal and like sort of like breach customer private data as well. So that is something to be very mindful of and see how we can like sort of like encrypt and tokenize information for better data security.
So from my perspective, I think like, I can start with the data perspective first. So in US, we have HIPAA, right? So that protects the information for patients. If you go to Europe, there's GDPR, which allows the companies to protect personal information from uh, any user, right? So first of all, if we are trying to build AI-based technology, we need to come up with some regulations, and for that we need subject matter experts, be it local subject matter experts, or we hire somebody from like the Western world who has already implemented, or maybe we can just take a leaf from Western countries who have already implemented this and then modify that to fit in our own ecosystem as well. So I think that would be the first important phase where we enable our organizations to handle the data with care. So when we like build an application here, especially for let's say AI healthcare use case, we do not allow people to see the raw data in itself. So we make sure that we obfuscate majority of the personal information or personally identifiable information for not just the medical patients, but anybody who is like, in the system. So we need to think about from that perspective as well. And then as Asfar mentioned, we need to build guardrails. When you are training the model, majority of these will be essentially trained using the actual data. And that's basically becomes much riskier when you ask questions about, okay, what was Ahsan's like, blood type at some point, and somebody has trained the model with my information, then it may just answer that question, and we don't want that to happen eventually. So we need people who understands under the hood the risks of training these models and how that impacts downstream for utility purposes as well. And cybersecurity, generally speaking, after LLMs has become much more riskier for a lot of organizations. Now, earlier, usually like humans were like, facing or maybe like attacking human, and then they were like trying to protect the infrastructure of human versus human. Now it's AI versus AI. Like how effective your AI is, that's basically makes how effective your cybersecurity is. Essentially,
Mhm.
like, I don't know if you heard about like one of the latest models offered by Anthropic recently, Mythos, that detected a vulnerability in an operating system that is runs in a very secure operating system, which was hidden like for 27 years. No human being could even find that particular bug, but Mythos was able to identify that. So these are going to be some of the use cases in the long run you will see, and there might be some potential like big events we will see in next coming years where uh, unethical hackers will use AI to hack systems and like steal data, maybe like or steal resources, like because majority of our resources are now on banks. So anybody can just transfer anybody's assets from one place to another place and wipe out the entire database, and you cannot even claim that that asset belongs to me. So we have to think about from that perspective in the long run how we can make our systems more effective in terms of cybersecurity perspective.
Yeah, these systems are as strong as, like the weakest link. So the way that I advocate for it is looking at it from the 3P perspective: the platform, the process, and the people. So when it comes to platform, like identifying different systems, like your respective uh, system, then like, like how it like accesses and like transmits data across the internet to like, like a database or the cloud, that sort of like transmits information and like data to like an underlying server or like like the business application. So like identifying like like whenever like like these as like respective different um like areas to develop a moat or like a parameter around how we can like sort of guard not only the data that exists or like information that exists within these different verticals, but also like when they're transmitted as well. On the process side, there is the OWASP and the which is like the Open Worldwide Application Security Project, and the NIST, which is the National Information Security, you know, um, technology. Like like these organizations, they cover frameworks on how to identify, protect, prevent, monitor, and govern the like the cybersecurity strengths and like basically like like implementation essentially. So they're like like continuously following up with them on the latest principles and like keeping ensure like keeping yourself assured of like involving the right frameworks as far as that is concerned will go a long way. And then finally on the people, like it's very important to train the respective people on like like what possible data breaches they may exist, continuously like update them on briefings and like use cases so that the way that they interact and engage with technology is in a much more responsible, safe, robust, and secure manner as well, so they don't open up the suspicious or like fake like spammy email. They are careful when it comes to like putting in private information, and especially like access based system or like accessing these external tools or even via like public wi-fi's as well.
Thank you. So our next question actually comes from something Dr. Ali said a little bit earlier about research in academia then metabolizing into things that are happening very fast in industry. So in either of your opinions, how do you believe the role industry should carry and take in supporting global health initiatives?
I think like industry is like kind of like earlier in the early phases of AI, industry was lagging compared to academia. Majority of the AI concepts came from academia. Like there's a really good book, Genius Makers, like that kind of changed my perspective of moving from academia to industry, because that book basically talks about how all the academics who built this AI technology brought this to industry, such as Google's or Microsoft or Amazon's and Meta's of this nowadays, right? So essentially, like, now I think industry is shaping how AI is being adopted in different fields. As I mentioned earlier, that companies like Novartis are using AI to expedite the uh, discovery of drugs for cure of different diseases. Similarly, like, hospitals are using AI to build applications through which they can help doctors summarize the patient history so that they don't have to spend a lot of time reading notes and identifying, like, what are the different doses they are taking, and that helps them, like, see more patients, especially in the US, right? So that can also be helpful in countries like Pakistan, where you do not have a lot of time to interact with the patients, understand their entire history. You can just, if you do have something like that, you can just quickly look it up, and then you can help patients as well. Other than that, I think like I've seen other applications where, for example, like if you are prescribed a drug, people do not like take drugs on time because sometimes they forget, sometimes like they don't like taking drugs. Like, so there are like applications out there where they are building these specific maybe pill carrying boxes, which is AI enabled, which can help patients remind them, okay, you have to take this pill or this particular drug at this particular time, so that you can keep up, or you can keep your dosage at as a minimum pace. And these kind of applications can also help keep track of how these, especially using the wearables, how each drug you are taking is impacting your health. For example, is it increasing your blood pressure, is it decreasing your like, maybe blood sugar? So that gives even more information eventually, and you can collect all of this information, because when we do drug discovery and when we do analysis of the data, we only do on a sample of the population. So if and we don't understand, like, human autonomy is like very different for different people, different regions, as we were just talking about, like, how do we enable people in Pakistan using the data that is trained on US. So if we collect this data from different regions and vast number of population, then healthcare and AI is going to be very personalized to each one of us. So essentially, like, you are scheduled, like, you wake up at this time, you basically have this kind of routine, you have meetings at this time, maybe you take this kind of dosage at this time. So that helps us, like, keep our health in check, and then we can expedite, maybe enhance human capabilities in the long run as well, as we are already seeing the average span life of humans is already increasing from, like, now in US it's like 70, 60 years, I guess, from, like, couple few, maybe few decades ago. But with these kind of enablements using AI, we are going to be able to extend that as well in the long run. So I think, like, there's a lot of collaboration and exciting things are happening in industry right now that can help us solve some of the complex challenges in healthcare using AI.
Yeah, like just looking at the strengths of, like the industry, what they do like do really well is, like they have like the access to capital and the ability to experiment and move fast, essentially. So I think like, using that as a means, as a like, like an asset to really like fuel innovation and experimentation within these within the global health sector. Uh, One example that I, like bring is, like when I was in grad school, I was, like working with to understand use cases for like, healthcare system, hospital system, large hospital systems trying to like, like, and they were very like willing to put in resources into trying to like engage innovation as the way, how do we think about it? One of the use cases that came out of, like part of the conversation was, like that one of the organizations were trying to increase innovation within their own respective like ecosystem and environment. So what they did was, like and just like adoption of AI technology, so what they did was, like as a side off, like as a side projects, encourage employees to with like, like with proper funding and the right incentives, like, like participate in hackathons, and like, the ability to like come up with ideas to improve um, a particular scenario or a particular like problem case that were given, and they were then, like subsequently rewarded for their idea as well, and like and could like put it into implementation. So I think like, like that access to capital and that ability to like experiment quickly and get to iterate quickly, get feedback, and then just move fast can be very vital, especially for the global south, and trying to understand the respective use cases, the underlying problem, and then how do we sort of solve them as well. And this ability to encourage innovation by incentivizing it, by just encouraging experimentation, goes a long way in capturing that feedback. So that was really impressive.
Thank you both. So our next question tackles on Pakistan and the global south a little bit more specifically. Are there any unique opportunities that either of you have identified that Pakistan may have to leverage AI for their healthcare improvement?
So from my perspective, I think there's a big opportunity for students who are in the universities right now, and then they're about to graduate, to think about how we can solve any industry, not just AI, and not just in healthcare. There's a lot of opportunities in Pakistan to solve using AI, because it's easier to experiment nowadays. You don't need extraordinary skills to code. All you have to do is one subscription of Claude Code or maybe any other coding assistant. I think there are free versions as well. And then think about how we can solve a particular problem. And I think if you look at Pakistan's perspective, there are major challenges in terms of education literacy, in terms of healthcare specifically. Majority of our population neglects minor health issues because it's expensive to get help from healthcare. Our systems are overburdened. I think we can provide them easy access to information using different platforms like smartphones or maybe any other messaging service. Like you just ask a quick question, and if we have a very good vetted process through which we can provide information, we can give that information as well. And generally, if you think about from literacy perspective, we do not have very good hygiene in our rural areas where majority of the people are suffering from these health problems. That is a big issue right now, and we can just educate masses using these platforms. That would be really helpful as well. And I think in global West, if you think about the lifespan of newly born kids, it's beyond 95% of the kids live beyond the age of 15. But I think there's still a lot of improvement that needs to happen in our region as well. The newly born babies are exposed to all of these diseases. We do not have proper I think procedures through which we can help them for vaccination and any other healthcare related issues. So I think we can help that as well. So looking at the broader spectrum of healthcare challenges, Pakistan is very broad, and there's a lot of opportunities where we can help. From my perspective, we can start small, build a unified platform where we can just start by educating masses and then provide additional services as we go and with more resources.
So I'm very optimistic on the future of Pakistan. I believe that the local problems will of the global south and of Pakistan, the solution to that will come from the global south. So I've having worked in the industry with some of there is a massive and highly trained talent when it comes to doctors and nurses, and then also on the software development side. I think it's world class. It's comes it's highly competitive and really state of the art individuals that are coming out of these institutions. What is important is just providing them with the right ecosystem and the right network to channel their curiosity, their innovation, providing doctors and medical staff with opportunities such as hackathons and prize competitions to try to look at local problems, and then trying to sort of come through with an idea or with an opportunity to solve that. I think that will go a long way. And on the technology side, just like the software development, it is sought after in the globe as well, because it's highly effective, the quality is great, and then also it is relatively cheaper when it comes to other areas. So just utilizing that in an ability to deploy accessible technology via smartphones, via browsers, and just providing that outlet to the masses would go a long way. And I think I sort of like quote this to people, but like I am amazed by the, the jugaad, or like, like the fixed mentality of my countrymen, like women. That ability to, like hack and like problem solve is incredible. And it's really something that I really cherish. It's all about, like how do we sort of like, use that to build up like not just like quick fixes, but also like towards longer term and long lasting solutions as well, with a more systemic scale.
Perfect. Thank you both. We have about 15-ish minutes left in the seminar. If the attendees have any questions, please feel free to leave them in the chat as well. I will be moderating that. If not, right now we'll move forward to one of our reflection questions. So, is there any advice that either of you would give to students that are interested in the intersection of AI, healthcare, and public policy? You both touched on students in the global south, students just globally in general, who have a lot of passion for AI and for making a difference. Any advice for them?
Asfar, do you want to go first, or should I take it?
Yeah, I was just like, no, I can go first. I think it's a great space to be in. So I would recommend, just like starting early and like explore problems rather than the solutions or like the tools and the technologies. So try to identify what are possible niche cases or value that, or like, like a pain point that, like that really is dire, and that can only come up with, like being local, being more context driven on that problem, who it impacts, the severity of that. And thinking from a really first principles perspective. The solutions are like phenomenal. Like you have like tools, like not only Claude and Cursor, and Codex, like for coding, but then also you have like Lovable for like design, and then also like like agentic, like really no code or low code tools such as N10 or Mind Studio that allows you to like sort of like workshop and like develop these workflows. So just like definitely focus on the problems, and like trying to see how you can like solve, and like what are some of the more dire needs that we need your minds on. Second is just like be critical when it comes to this technologies. Read up on like policy, like the trends, and then making sure that like you don't just like take the output or like take the results of these as just like as the be all end all. Try to like really evaluate, try to measure your work, measure your progress, measure the outputs of these, and like take it with like a grain of salt that like this technology is transformative, but then like is it like doing the best that it can, or like are we getting it to be the best, to be at the best level as we can. So just definitely like critically evaluate the output and like the consequences of this technology, not only within like like your circles, but like wider society as well, when it comes to adoption, especially with AI technologies, with patient private data at stake, and like like the data security at stake, and like just like government trust and policy around that. So, yeah.
I can build on that. So, like, as Asfar mentioned, like, think from the problem perspective, I think, like, beyond just the problem, there's another aspect of AI. AI is really good at solving generalized problems. It will give you generalized information. It will give you like generic information that's available on the internet. I would say, like, if you are in a particular field, get some in-depth understanding of your own field, and that will give you ideas of what are the key potential problems in my field that I can solve. Another aspect of AI is nowadays is like, I saw a meme, and that came up multiple times on my social media feed that says like you need a full-time job to keep up with AI. So that is 100% true. There is a lot of innovation happening in AI right now, and there's like left, right, and center papers are coming out, new tools are coming out, new like models are coming out. It's really hard to keep up. But I would say instead of going after the shiny new tools, just start small and then start experimenting as much as you can with like whatever information you have, instead of going through the new topics and new LLM, because usually like new tech, like those newer models are like not the ultimate solution. Just getting started will help you identify where the gaps are in existing system, and then you can do research on what is the exact next solution or new model you can use to solve that particular problem. So it's just an approximation principle, right? So like whatever like the next opportunity you create is going to be like, identify the new problems, and then you can keep solving those opportunities as well. So generally that's how I will think about it, from how I will start using AI in general. And from the like experimentation perspective, I think like, don't be like scared of, I don't know coding. Should I just go use Claude, or should I use like, Codex? I think at this point, like I don't even code at this point, to be honest. Like I've been coding since I was 13 years old. I started writing code when I was like in my eighth standard. Like after that, now in last 1.5 years, I hardly code anymore. I just like go to a LLM and say like, can you do this for me? And then just talk to the LLMs as if like you're talking to a friend. Like, it's like a genie. You just tell your command or wish, and it will do it for you. I think that's the way to go. And as you keep doing this, you will get more confidence, and you will start solving a lot of different challenges or problems you will see in your field.
Yeah, 100% agreed. Shreyas Doshi, who I follow, he's a product lead and like leads coaching on AI and like product development, and he's worked at Stripe and like Google and Twitter in past life. And if you don't follow him, I would highly encourage you to follow him. He shared a key insight that I'll share with the group here. What he said basically is that these models will continue to get better and better. This technology will be transformative. So the way that you think about the key skills to develop, or like the key value that you bring on the table, is to think that your technology, you having this state of the art technology, your competitor will also have access to the very same technology, right? So, what is the key differentiator that you have? That key differentiator is your strategic advantage of like providing key insights and like taste and like value judgment on how to use that and how to engage with like the output or the outcomes of this technology. And I think people and organizations and governments will seek that like that insight and like that value judgment that you have to offer. So try to seek and like try to optimize on how can you like leverage these technologies to critically to build up these critical thinking and like these value judgment skills, which will be very um like in high demand as these technologies progress. Because yeah.
Perfect. Thank you both. We actually have quite a few questions that are in the chat right now. So just going on one of them, based on the first principles that you spoke about, what is the simplest problem that South Asians in South Asia can solve using healthcare AI that focuses on prevention instead of curation?
I think like, for if you want to talk about prevention, like you have to educate masses. I think we can build some sort of platform where like majority of the information is available, like how to maintain good hygiene and how to make sure like you are eating right food. I think in our region of the world, people don't take nutrition as like, as the first thing, because I don't think that's very important. We just our cuisine is like, usually we say it's very healthy, but I think it's not really healthy, to be very honest. Like we eat a lot of oily food, and our food is highly carb intensive. So I think like generally providing those kind of guidelines of how should you eat, like, there should be protein, there should be like some sort of carb, there should be some fiber. So that's just basic, like, dietary information, like just one field, right? But there's a lot of similar fields you can provide similar kind of information. And like, telling people how can they work out, like they don't have to go like, lift weights in the gym, and they can just go walk like 10,000 steps a day, just go for a walk, and like, these kind of basic information. So if you are in this field, you can build an app that can provide similar kind of information to masses, essentially. And eventually, like if people are using your app, you can then monetize it by bringing multiple products, and maybe like, bringing multiple sponsors or bringing multiple advertisers on your platform. I think that's where we are like heading towards right now.
Perfect. And then we will take one more question from the chat. We'll move on to our last question right after. So, how can we leverage existing leading LLMs like Claude, ChatGPT, etc., and build it focused on healthcare? Where do you think the future lies for popular LLM use cases in healthcare?
I think like nowadays, like majority of the LLMs, like if you go to Claude or if you go to maybe OpenAI models, like all of them are on par. There are like some minor differences, generally speaking, but majority of the tasks they can do like equally well. So I feel I wouldn't spend too much time on like, what model should I specifically use, because nowadays even uh, large enterprises are not even focused on that. They know exactly like, each of these models are capable of doing majority of the things. Maybe they might have some niche information that you can still get by doing some prompt engineering. I feel like, if you have a specific problem you want to solve, just pick a model, generally speaking, not to be like, very picky, and then start talking to it and maybe like, ask it to like solve it for you. And then if you need additional information, just provide the context, like provide specific information about like, okay, I want to build this application using this particular technology. Can you look up this paper and implement it using this technology? So like, that's what I do usually. Like if I'm building an application using newer like say let's say techniques, I just get a link of that particular paper or just a copy of the paper and give the paper to the LLM and ask like, can you first of all read this paper and then explain it to me? And after that, like, can you help me build a proof of concept using this, and then show me the results and how can I explain it to people? So that way I basically iterate with the AI and then try to understand how it thinks, and then I try to replicate the same way in my workflows as well.
Yeah. I would like to add that, like, I think like sometimes the simplest is the best way. Like, I'm a big pen and paper sort of, like believer. So, how I would urge in this is that, like, like with recent technology, it's very easy. And like, some of the like even no code or low code platforms like, like N8N, like that, where you can like create workflows for agentic applications. You can literally like plug and play, different models and like different LLMs. What is important and what is key for, like the healthcare space and like the global south in particular is picking the right problem and like, like utilizing, okay, like where does that severity of like the problem lie, and like who are the stakeholders, and like does it make sense for us to like target that. Basically just like these are going to be hard questions to focus on, to identify like where should I be like working with, and like this like like developing that solution, again, like that comes secondary. You can utilize like these plug and play models, and basically they can draw out like through an iterative manner, one by one, to see, okay, like what is the intended outcome of this? Does it come up to that? Measure that, like, like like when I queried that, or when I, like sort of like access this model, did it come up with an intended result? Take a look at the log of interactions, like, or like log of engagement, measure that data and try to improve and continuously like uh, iterate on this cycle. I think this is a key distinction when it comes to like AI development versus traditional software development, is that AI development is a very iterative process. You continuously and constantly trying to improve the output, and like improve the response, and like you need to utilize the data and like the information generated in order to feed back into strategies to improve that, rather than like like from a start to finish process that usually like like traditional software development has taken.
Thank you both. We are already at 7, so we're going to wrap up with our last and final question. In one sentence, if there's any message you could leave to this audience tonight, what would it be?
So from my perspective, I feel like, if you want to break into AI, I saw a couple of messages about like, I'm in a particular field for like certain amount of time. How should I use AI? Or if I want to like, go to AI, should I start learning coding? So from my perspective, I feel like instead of learning coding, bring your own perspective from your own specific field. And that is your key value you are going to be bringing on the table, because subject matter expertise are the key in the next era, where AI will solve the general problems. And if you can bring that perspective, that will help you like break into this particular field as well. And just knowing a little bit more about AI, like what models use, and just definitions of agentic works and how it works, that should be sufficient.
Yeah. I saw a question about like, like asking about who I quoted. It was Shreyas Doshi. So I've like, put him in the chat and you can share that with respective, like participant. What I would, like urge everyone to leave with is just like one word, trust. How do we build trust when it comes to this technology? Because at one end you have people who are very excited and like like very eager when it comes to this technology, and on the other hand you have people who are apprehensive and like actors who are like really cautious. So when it comes to like this technology or like any particular product or system, just think through like what would drive adoption, what would help build trust with the intended audience. How can I enable that in the systems and the solutions and the um, platforms or like technologies that I develop? What would make it easier? What would make it more secure and robust and safer for different audience members? So just like think through like, like not only like, your customers or your clients and, your business stakeholders, just think through from a wider audience and wider consequential perspective. Like, will this technology or will like this initiative and like how I choose to solve it, will this build trust in the system? Will this build trust in like AI systems and like continue to propagate that, or would it like lead to more barriers as well?
Thank you both for this extremely insightful conversation. And with that, I think that concludes our webinar and seminar today. To conclude, I would specifically like to thank the other fellows within the APF UN cohort, Anaya, Wajiha, and Zuhair. And beyond that, I would also like to thank APF as a whole, specifically Maha, Dr. Q, Dr. Qureshi, and Mustafa for their support and all of their help with putting everything together. And lastly, I would like to thank Dr. Ali and Asfar for joining us today and giving such great dialogue to the community about AI and how we can move forward with healthcare in the global south.
Thank you, Tareem. Thank you, rest of the APF team, for inviting us. Really appreciate that.
Likewise. Thank you, everyone. It's an honor.